Every single year between around December and February, we get a ton of viruses floating around. And if you worked in healthcare or, maybe, and if you're relatively healthy, to most of you it would be like, yeah, I've got a cold, I get the sniffles, I feel kind of achy for a few days, but that's it, I had chicken soup and then I'm fine. But there's 7 to 8 viruses every year that come. Some of these viruses can be very dangerous to certain types of people. And now we've added another coronavirus, right? COVID-19 is a coronavirus. It's just a new kind of worse one that we've had. And so my original point to everybody in this room is we're never going to get away from the respiratory viruses. So the key is, how do you make a plan every year? How do you make a plan to stay healthy? So COVID-19, Omicron is still floating around. There's a bunch of sub-variants of Omicron that keep changing. And about every 6 months, assuming you've been vaccinated, and a lot of us have actually been infected with COVID-19, our immune system, it wanes. It's not as strong as it was 6 months ago. And so we become more susceptible not only to getting COVID-19, but potentially getting sick from COVID-19. So how do you prevent that? You keep up with your vaccinations, right? So there will be a new COVID-19 vaccine available to everybody in Ontario over age 6 months in October. There's various companies that come out with them, but at the end of the day, they're all pretty much equal. There will be an extra emphasis this season on the following populations. Any child under age between 6 months and 5 years of age who has not been vaccinated yet against COVID-19, anybody over 65 years of age, anyone living in long-term care, anyone with a chronic medical condition, diabetes, hypertension, heart disease, kidney disease, lung disease, anybody who has an immunocompromised immune system, anyone that is pregnant. But if we can get a high vaccination rate on the groups I just mentioned, we are going to do very well in Ontario. So vaccination is very important. What other vaccines are available? The flu shot. I get my flu shot every year. I've been getting it every year since medical school. That will be available to you again at no cost. You can get it at your family physician. You can get it at the pharmacy. Please get your flu shot. Again, anyone 6 months of older is eligible. Okay, so we've talked about vaccines. Let's talk about other quick stuff that can make you better. All the things your parents taught you early on. Wash your hands, especially before you break bread with people, right? If you're feeling sick, please stay home. Don't spread it around on the subway, at work, and school. Drink lots of fluids. Use Tylenol if you have a fever. It's very safe. Just follow the instructions. And finally, if you get sick, and a lot of us are going to get sick this winter, right? Know what you're going to do. First lesson, if you have a primary care provider, go and see them, right? And one more pitch, there's a website called Stay Healthy Ontario, one word, stayhealthyontario.ca. It has everything I just said, probably in a little bit more detail, and it's a wonderful website that the Ontario College of Family Physicians just put out.